Good morning. I'd like to first thank the organizer and Green Crescent for the excellent hospitality. It's been a really lovely conference so far. I hope to not take very long. I'm sure you're all dying for a coffee and a break, so I'll try and be as fast as possible. First and foremost, I want to locate my study. Strictly speaking, I'm not talking about school-based prevention at all, okay? But my study will have implications, I imagine, for school-based prevention. In fact, the study was not conducted with children. It was conducted with a group of young people called emerging adults. We do know that today the period of adolescence is becoming increasingly protracted. It's much longer. Young people remain young for longer before entering into the more conventional commitments of adulthood. And therefore, this study explores, in fact, the career paths of a group of emerging adults who are self-identified as recreational marijuana users. They're aged 18 to 30, and who were actually screened for non-problematic use by a standardized screener called the QDIT-R, which was developed by Adamson et al. I also need to locate the study. This is part of the postgraduate research program at the Department of Youth and Community Studies. So it does take on a little bit of a youth and cultural studies framework. Okay, so what were the main objectives? The main objectives were to identify the contingencies associated with the career path of marijuana users through their lived experiences. We have, over the past 2 days, listened to a lot of presentations that highlight statistics. I've seen lots of graphs, lots of percentages, experimental conditions, independent variables, etc. This study is, in fact, a qualitative study. It's much more sociological, and it documents lived experiences of young people who actually engage in recreational marijuana use on a regular basis. In this respect, it attempts to give such young people a voice. I think it's very important to not only listen to the scientists, but also to the young people who are experiencing this phenomenon. The study also seeks to understand how young people themselves define their marijuana use, how they view, what are their representations of their use, and to document the practice of such use amongst this group. In this respect, it does hopefully contribute to the changing shape of the addiction field. The construct of recreational use is still very much contested. So, I mean, the very first session in this conference, Dr. Gilberto Guerra said we should not be talking about recreational use. However, there are people out there who are using drugs and who define themselves as recreational users. So I think it's very important that we listen to what they also have to say and see whether this is a possibility. Okay, so the theoretical framework for this study is it utilizes the construct of career, which locates drug use as occurring along a continuum, and the movement along that career trajectory is influenced by a number of contingencies. Contingencies are basically factors that make movement more or less likely. This model has been successfully applied to criminality by myself and my doctoral research and by other authors, and also is a possible framework for understanding drug-using trajectories in the lifespan. An addictive or a drug-using career has a beginning and an end. At some point, most drug users do desist. Then the career length in between. During the career, drug users engage in drug-using behavior at different rates and experience different motivations. So the concept of career emphasizes primarily the subjective point of view of the actor in relation to the trajectory or the life path that his life is taking. I also noted that a lot of the presentations emphasize that there are a lot of factors of which the drug user is unaware that are pushing and pulling him towards drug use. This perspective takes a little bit of a different angle on this and highlights that human beings are reflective actors They act purposively, they are rational, they are reflexive, and they interpret the events that happen in their life. Therefore, drug users are not seen as passive puppets at the mercy of control, of forces beyond their control, but rather are deemed to be active in the choices that they make. Of specific interest to the Kariyer theoretical framework is the construct of identity. So a very important contingency is how young people see themselves. At what stage do they come to see themselves as moving from simple experimentation to more committed use? So how it affects one's identity. The career construct may be conceptualized as a corridor with doors leading on to more conventional lifestyles. And once again, I firmly believe, and people from this tradition also highlight, that users are not constrained to stay in the corridor. They can exit back onto conventional life at any point. Sometimes when one progresses along the corridor, it becomes increasingly difficult to turn back, but it is never impossible to do so. This contrasts significantly with the medical model, which when applied to drug-using behavior is founded upon the subordination of personal agency. So, in terms of contingencies, this research identifies both subjective contingencies and more objective contingencies that are encountered in the career path. Drug use is seen as being located along a continuum, and individuals may fail to progress. In other words, they can actually stay at a particular stage without moving to more problem use. This is not something that only I have dreamed up. For example, Orford, who's a social psychologist, who's written a lot in the field of addiction, highlights that while a large number of people experiment, it is only a few who move on to problem use. So, we need to talk about what is recreational use. Obviously, I do stress again that this term is contested. There are some organizations that simply don't agree that it is possible, and some individuals who feel that recreational use does not exist, all use is problem use. But I'll just take us through some main definitions. I utilize a lot the work of Howard Parker and his colleagues in the UK, who wrote a text called Illegal Leisure in the 1990s, and Illegal Leisure revisited again in 2005. And Parker defines recreational use as the occasional use of certain substances in certain settings in a controlled way. So here he emphasizes the non-frequent use and also the issue of control. Mackenzie, on the other hand, emphasizes the lack of problems that recreational users encounter in their daily lives. And the EMCDDA, in a publication which is available online, also talks about recreational use and the possibility of such use, emphasizing, however, the leisure component in young people's lives. Okay, so the study is also informed by the normalization hypothesis from Howard Parker, which essentially says that we can't continue to think about young people who use drugs as essentially having problems. This is because drug use is so widespread that that would make most young people at risk, essentially. So the normalization hypothesis highlights how drug use may simply be a way of combating the high demands that are placed on young people in postmodern societies, and may be seen as part of a youth lifestyle which emphasizes working very hard, because there are lots of pressures, but also playing very hard. The normalization hypothesis highlights how in today's society illicit behavior has become increasingly culturally accommodated. So we might watch television and see people smoking marijuana on TV. Parker does highlight, however, how even recreational use poses risks, because this means that young people might always transition to more problematic use. So the methodology, as part of the postgraduate program at the Department of Youth and Community Studies, the study utilized what we call a sequential transformative strategy, which means it was primarily qualitative and in-depth, but it also engaged in some quantitative study in order to recruit a sample. So basically, the research process took place in 2 stages. We have first a sample of self-identified recreational users who were recruited online, undergoing a screener to screen out those individuals who classified as problem users through a standardized tool called the Q-Data. And this was followed by in-depth interviews to document the lived experiences of 9 participants. This is a small-scale study, but the interviewing took place over 3 interviews with each participant, so significant qualitative data. The study was granted ethical clearance by my University Research Ethics Committee. So something very small about the Q-Data. This is a tool developed by Adamson et al., which has been standardized, which screens out people who have problematic use. Obviously, abstainers and problematic users were not involved in the qualitative part of the research. So 127 valid responses were achieved. Strangely enough, females normally respond more, but in terms of substance use, we know that the gender dimension here leans more towards males. So we had 55% males and 44% females. And then 9 participants between the ages of 18 and 30, emerging adults, were interviewed in depth. So basically, the interview, which is divided into 3 sessions and took place over 3 different timings, explore the young person's definitions of recreational marijuana use and the representations of their own use. The second part of the interview explored the drug-using career, focusing on onset, escalation, commitment, and desistance. And the third part of the interview highlighted the different motivations for use. The analysis took place using what we call a constant comparative method from grounded theory. So obviously many limitations. It's a convenience sample, although there was equal representations in terms of gender. All the young people in this study were socially integrated. These were young people in employment. They had educational careers which were successful. Therefore, it does not include a group of young people who are socially marginalized. The sample is also very small. That does not allow for theoretical saturation. So let's look at the analysis. Basically, the analysis explores the participants' experiences in their marijuana using progression and examines the trajectories marked by onset, escalation, maintenance, and desistance. One major important theme that emerges is that this is a process of socialization. When I say socialization, I don't mean socializing, but rather a process whereby young people are integrated into a particular youth cultural formation. The data indicates that young people actively learn to use drugs and to recognize their effects. This was also highlighted a very long time ago by one of my favorite authors, Howard Becker, in his book Outsiders. Very important, and a theme that emerged was that with increasing use, this brought about changes in the self-definitions of the users who came to then identify themselves as recreational users. So another important theme was that the addictive career or the drug-using career is non-linear. So this does mean that basically the individual starts from one stage and necessarily progresses in a linear manner to the rest of the stages, but rather the individual can move in and out of the career with desistance happening quite regularly for a number of reasons, as I shall show. So I've been told I don't have much time, so I'm going to rush a little bit through this. Contingencies for onset, nothing new here. We see curiosity as being experimenting with the mood swing, and friendship patterns being very important. But I do want to highlight as well the context. Norms are very important, norms regulating the behavior. So young people who did experiment found themselves in situations where there were normative structures that allowed them to do so. Learning the mood swing was also about learning about the effects of the drug and how much to use. So regulating one's use, not using too much, not using too little, etc. So that is an important contingency at this stage. Peer pressure was unanimously rejected by my participants, who emphasized that they were active in deciding to use drugs. The stage of escalation is very important because this is the stage which poses most risks for young people. Escalation is when tentative flirtations with marijuana use escalate to more consistent, more frequent use, and where individuals perhaps may tend to lose control, okay? However, what I do want to emphasize is that escalation does not necessarily lead to commitment, but can actually, and in my sample, very often led to desistance, okay? We shall see why. So, I need to go one back. Okay, so the contingencies for escalation, participants reported that these are contingencies which are associated with the cultural conditions of emerging adulthood. I do want to emphasize that it is important for us to consider culture. Yesterday, during a presentation, I heard somebody talk about rats who were in the period of adolescence. Possibly rats are in the period of adolescence for something like 3 months. I know nothing about rats, but young people today are in the period of adolescence and emerging adulthood for many, many years. And this period of emerging adulthood is one where young people start to get jobs, so they become more financially independent. They also tend to move away from home, and therefore they're not, strictly speaking, under adult supervision, which often increases their use. Also, the fact that they were financially independent meant that they could acquire their own stash, which meant that they did not need to rely on peers in order to consume. Okay, so the cultural conditions here are very important. Something emerging adulthoods do experience, and this was highlighted by Arnett, who says that adolescents during this period are still not entering the commitments of adulthood, but do have the freedom to explore that is characteristic of adolescence. So it's a very self-focused stage. And one emerging theme was that the lack of structure during emerging adulthood, the fact that they did not have important jobs to go to or families to take care of, meant that they could escalate their use. So I'm going to leave out commitment and move to desistance. Most of the young people in the study were current users, but they all had experienced a period of desistance. In other words, they stopped their use by themselves without any help, without any psychological intervention, social work intervention, etc. They cited the main reason for their desistance as being financial restriction. So they they didn't have money, they needed money for other things, and also the lack of availability. But perhaps most important is that desistance was engaged in order to regain control. So basically, these people felt that they were losing the plot a little bit, losing control, and decided to stop in order to regain the control. Here, once again, I emphasize the human agency, okay, the fact that these people felt that it was up to them, the decisions they were making. Okay, with regards to the representations of recreational versus problem use, very quickly, the issue of control was highlighted by participants, as was the issue of pleasure, that mainly this was use engaged in for pleasure, doing it just for the pleasure of it, and that it did not interfere with their adaptive functioning, as well. This really doesn't work very well. That they also had alternative courses of action. They were not constrained to engage in this behavior. They had a variety of options, and it was very much their choice. Frequency of use was also highlighted. Basically, daily use was considered to be particularly problematic. And they distinguished between wanting to use rather than having to use, okay? So in terms of the need, the physical aspect was mainly emphasized. So very quickly, discussion. The young people in this study defined themselves as recreational users, describing their drug use as being occasional and controlled. I think this lends itself to sort of a number of issues that we might consider. The first is, does recreational drug use exist? Can we talk about recreational drug use? And how do we define recreational drug use? I actually suggest, and these are highlighted in more detail in my paper, certain criteria for operationalizing drug use more consistently, such as having clear norms surrounding the behavior, changes in risk assessment, the lack of centrality in a person's life, lack of preoccupation, continued adaptive functioning, and lack of difficulty in reducing the behavior. We do need to consider that this was a possibility which was identified by Shiner and Newborn as a reaction to Parker's normalization hypothesis, that these could simply be rationalizations, somebody mentioned this, rationalizations by drug users in the face of knowledge that they are doing something that society condemns. This requires further research. And I think very important is that we consider that the possibility to transgression to more problematic use is always there, and we need to develop models highlighting these particular moves within the addictive career. Thank you.